My name is David Lee. I'm an acupuncturist and a practitioner of constitutional medicine. Today, we will be going over a patient who had reflex sympathetic dystrophy using constitutional medicine, which includes Bisoma acupuncture, Tetrasoma acupuncture, and Sasang herbal medicine. All right, this patient is a female. She's age 65. She was a nurse because she had a bad car accident 22 years ago, and it crushed her left upper body, her shoulder, and her upper chest area, and that really was the start of her major problems. And that, of course, led to reflex sympathetic dystrophy, RSD, and brachial plexus syndrome. When she came in for acupuncture, she had the worst pain in the left inguinal hip area, but she did have significant pain in her shoulder. She does have limited range of motion, and she had neuropathy in both the legs and the feet, pain in the ribs. Also, her hands turned purple in cold weather. These are her additional complaints. She had cancer treatment a few years ago, which aggravated RSD symptoms. Her pain was worse in cold, damp weather, or when wind just touched her skin. It would just make her skin crawl with a lot of pain. And stress would aggravate it. She was also sensitive to foods, a lot of variety of foods, and so they would cause problem. Increase in pain, increase in discomfort. Over time, through years, she slowly recovered, and the cancer was in remission when I saw her for 2 years. She did have many natural therapies, whether it's clean way of eating, or certain foods that are good for her, or certain natural substances that were good, or even acupuncture. She had that, and so overall she slowly progressed to a point where she was able to walk 3 miles a day with minimal pain, and she was off all medication, including Norco and gabapentin. But her RSD easily flared up with damp cold weather, or by wind, or stress, or food, and for unknown reasons. These are the acupuncture points that I used. Right and left side horary points in metal order. That's Li1, that's a metal point, UB66, water point, gallbladder 41, earth point, small intestine 5, fire point, stomach 36. That's an earth point. I did those points on both sides of her body. I added additional acupuncture points. They are Li11 and gallbladder 34, which are earth points, because her earth element is the center, or the most important element of all the 5 elements, because her earth element is deficient, and increasing the earth element helps to increase fire and metal and decrease the wood and water. You notice this patient constitution has wood excess, fire deficient, earth deficient, metal deficient, and water excess. There's other ways to diagnose this constitution, not just East Asian or way of diagnosing, which would be a lesser yin and greater yin. Lesser yin means excessive water, not enough earth. Greater yin means excessive wood, not enough metal. Other names, according to world systems, such as Ayurveda, will call it kapha. In Unani, it's called melancholic. In Nidhi theory, it's called affiliation. In social styles, she is conscientious. According to Myers-Briggs 16 personality type, she's an ISFJ. Different names, same diagnosis of the constitution. This patient had a total of 43 acupuncture treatments in 7-month period. Yes, 43 treatments is a lot, but she had extensive injury 22 years ago, and she's still recovering from it, and she could not work. She's very limited in her ability to do things throughout the day. And yes, acupuncture definitely helped her. She was incrementally improving on a weekly basis. On the 17th visit, I added the earth points Li11 and gallbladder 34 on the left side because the first 18 treatments were just on the left side. And then once I figured out all the points that were relevant to her on the left side, I tried the right side only, and I did mental order Li1, UB66, gallbladder 41, small intestine 5, stomach 36. And it was again helpful. So therefore, I did bilateral of the earth points and the horary points. That helped her to improve even more. So then those 36 acupuncture only treatments in 6 months helped much. And she was more stable, but she was still sensitive. Her pains easily flared up with stress, wrong foods, damp weather, and wind touching the skin. From the 37th visit, I gave her a constitutional herbal formula. It's called Guitsu Bansha Xinjiang. The ingredients are Xinjiang, Guitsu, Bansha, Baishao, Baitsu, Qinpi, and Gansa, which definitely helped her further because it was noticeably better every week. And her condition increasingly became stable, even with stress or other stressors such as change in weather. She was able to walk on barefoot on hard floor with less neuropathy. That was first time since injury 22 years ago. Not only that, she was dancing in front of me with her arms and her legs like a person with fluidity. She was dancing really comfortably, and that was a really nice sight to see. Yes, overall, pain from 8 to 9 out of 10 was down consistently at 2 to 3 out of 10, and when it get flared up, then it would flare up to 5, but not nearly to the severe state that she was at. Then how did I diagnose her body type, her constitution, as being cool and dry? Well, here are several characteristics. There's in-person characteristic that I was able to identify, but there's also some of the characteristics here. Not a comprehensive one, but some of them. She could read a book in the car, which means she's a greater yin. She does not get motion sick easily. Her pelvis is large. By palpation, I could tell it's very wide and big. Her pelvic bone is big, indicating she's a lesser yin, a cold type. And she's allergic to shellfish, that's greater yin, dry type. Many foods cause sick feeling. She's sensitive to a variety of different kind of foods, not because of her condition, but she's constitutionally that way since childhood. Indicates that she's likely a cold, dry type combination. That also includes hypersensitive to many medications. Same idea. She is likely then a cold, dry type. And she has insomnia. She has difficulty falling asleep. She has difficulty staying asleep, and that's been her theme throughout her lifetime. People who are prone to insomnia tend to be cold, dry type, which is lesser yin and greater yin in combination. And I did state that she's allergic to shellfish. This is a nice case to present because she has an intractable chronic condition where there were not many options for her. And some of the options were definitely effective, but we find that the way I gave her treatment with the acupuncture and the Chinese herbs helped her to improve more quickly, with more stability, and definitely more improvement. Why? Because all we have to do is have the right diagnosis and right matchup with the application. In this case, it was definitely successful for her. She's overall about, I would say, 80% better. She has 20% more to go. And that means she'll be functional and doing things on a daily basis with quality output and with minimal discomfort. If you'd like to know more about what I do, learn about it, I do have a 4.5 hour video on Bisoma on udemy.com. So you can learn about Bisoma. That will be a great introduction to learn this constitutional medicine. At the same time, you will be as good as a 20-year practicing acupuncturist, treating many variety of conditions.